Welcome to Suzanne's studio. I'm Suzanne Barnett, your host, and tonight I am so pleased to present Dr. Christopher Joy. Dr. Joy is a general and cosmetic dentist, and he's been on the show 2 other times. The last time was 5 years ago, and I just think he is so talented that the public should absolutely have to see him and hear him. How's that, Chris?
Thank you for that introduction.
No, I'm so pleased to have you.
It's my pleasure to be here. I can't believe it's been 5 years since we last got together.
I know.
Yeah.
Well, first of all, you have been in practice for 37 years.
Yeah, it's amazing. I think I still feel like the new kid on the block. There are just so many innovations in dentistry and so much to be excited about dentally, all the things we can do for our patients. I have no desire to retire and just excited for my profession going forward.
Well, you have saved my teeth. They were well on their way out, and I'll always be grateful to you. But what I want to say, too, is that I have been to a lot of dentists in my life. I really have, and I used to be terrified, and I had to take medication. And then I started with you, and it sounds like a commercial, but in my heart, I just am so grateful, and I'm so glad you're here. So, what do you think about that?
Well, that makes me feel great, but I owe a lot of it to my team,
Yes.
The people that answer the phone, the people that assist me, the people that clean your teeth, the hygienists have been, I couldn't do it without them, and most of them have been working with me for at least 20 years. So.
Well, that says a lot. It means that
I try and treat people the way I'd like to be treated, and I did every interesting job ever before I became a dentist.
Really?
And,
like what?
I worked in a scissor factory. I did landscaping. But I got an opportunity to work in a dental lab, and I said, this is interesting. And then it all fell into place from there.
Well, I was going to use this as one of my questions towards the end, but I'm just going to let's start off with that. What do you think is the most important thing that we people can do for our teeth?
Well, I'm currently the president of the Mid-Peninsula Dental Society, which is part of the California Dental Association and also part of the American Dental Association. And you look at the back of the toothpaste tubes, and it says that you should, brush your teeth a couple times a day, floss, and then see a dentist at least a couple times a year, and I think that's a really good start for most people. But I boil it down a little bit and says, don't eat junk and floss is probably the best things you can do.
For you.
Yeah.
And I just found out something. I'm going to have to get rid of my packs of bubble water.
Yeah, the fizzy water.
The fizzy water. I love that.
I love it too. It tastes so good. Yeah, there's nothing like it. It's very refreshing. But the carbonation tends to be very acidic. So even, fizzy water, like you say, or, Diet Coke, Diet Pepsi, they're all, carbonated and acidified, and it's to create an interesting sensation. And the problem is it's very detrimental to the enamel of your teeth. And, even something like orange juice, which, by the way, has a lot of sugar in it and a lot of acidity, if you're going to drink orange juice at breakfast, you definitely want to brush your teeth before you drink the orange juice and not brush your teeth after, because what the orange juice does, it etches the surface of your teeth. The acidity etches the surface of your teeth, and if you brush shortly after that, it'll rapidly wear the teeth. So there you go.
Oh, my goodness.
So it turns out that, and I'll show you a few cases in a few minutes, but most of the work that I do big reconstructions on is not decay or gum disease anymore, it's wear, and often wear that's accelerated by acidity, whether it's from exogenous sources in the form of soda or fizzy water, or endogenous, so acid reflux. I don't know if you know that that airway obstruction, sleep apnea, are often associated with clenching and grinding and acid reflux. So all of those things together cause the teeth to wear much more rapidly than they should. And with people living into their 80s, 90s, you just want to try and minimize that as best you can.
I don't like to hear any of the above. And I've been going to you for years. I do all the wrong things.
Oh, I don't think so.
But I've known that, really. Well, let's show some of your pictures.
Yeah, that sounds great, and I think it will help, move our conversation along.
Okay.
So, fine, let's show the first picture. Is there some spot that I can look to see? Oh, great.
Yeah.
Okay, so this is a patient that I'm right in the middle of working on. I'm sorry for the blacked out eyes. I didn't have his permission yet, although I'm sure he'll give it. But so what do you see when you look at him? He's a handsome guy, but
his teeth don't.
Yeah,
match.
they're very short. The upper teeth, right?
Yeah.
So he wore them significantly, and so he came to me as a patient maybe 10, 11 years ago, and it just didn't fit into his timing to manage that at that point. But now we're starting to do it. And the cool part about it is that we have so much better technologies to do it now, as you'll see, than we had before, that it's going to work out great for him. So why don't we look at the next picture?
Okay.
Great. So this is more of a close-up view. So the wear is evident on the picture on the left, right?
Right, yeah.
But then on the picture on the right, what we've done is we did a wax-up, and then this is called a mock-up, and what it is it's an impression of the wax-up of what I view as being a good final outcome for this patient. So you'll see that we've added material to the top teeth and to the bottom teeth, and in a pleasing aesthetic way, and the next slide will show that. So you can see him now. It's going to look a lot better when he has those teeth, isn't it?
I would say.
Right.
Definitely.
So, but his chief complaint wasn't really the aesthetics so much. It was really the function and the wear. Because as your teeth wear, they continue to erupt. So they appreciably look shorter and shorter and shorter as time goes by. So this case is complicated because you can't just fix the worn teeth. In order to make room to add material to the worn teeth, you have to add material to the back teeth as well. So let's go to the next slide and we'll show you how we do that. So this is a digital wax-up, a digital mock-up that I just worked on today with my lab technician who's in the building. That's one of our killer applications. I've got this great team of dental assistants, hygienists, and office managers, but then the lab tech is in the building as well. And so when we put this case together, we both get to look at it on a computer screen, and then I can say, okay, well, let's add a little length here, or let's change this contour here or there. And so you can see how those 6 teeth are going to look. They're going to send that off to a lab. They're going to send us back these patterns, and then we'll use that to make the ceramic crowns that are going to replace the missing tooth structure in his case.
So you really have to be an artist, a sculptor.
No question about it. Yeah, I think most dentists are very artistic. Yeah.
Do you really?
Oh, absolutely. I love photography. That's one of my passions, and a lot of dentists have artistic outlets for sure.
I didn't know that,
Yeah.
but I know that you're a fabulous surgeon, dentist.
Well, we're basically like 3D problem solvers, right?
Yeah.
So, and we just work in the mouth, which is got lots of unique characteristics to it, but it's where we do our art.
Yeah, I'll say.
Another picture. So this is a
my
fascinating
goodness.
case. So.
Who are those two ladies?
They're one and the same, but there's been about 1.5 years intervening between the picture on the left and the picture on the right. So when this patient came to me, she was the wife of a patient that I had done some veneers on, and he had had some of the wear issues that we were talking about with the first case, and it turned out very well. And this patient came in and said, I'd like to hear what you can do for me, and I'm expecting good things based on what happened with my husband. So as I listened to her story, she had had a lot of dental work done many years ago, And ever since it was done, it didn't really, she didn't feel well. She felt sick, she felt ill. And she subsequently, was searching for an answer, and it turns out that she was sensitive to some of the metals that were in the crowns that were done. So over the course of a year and a half, and with the help of a periodontist, yes, excuse me, go ahead.
No.
With the help of a periodontist, gum specialist, we were able to get her gums in really good shape. I can't do my art, which is, crowns, bridges, veneers, etc., implants, unless the gums are healthy. So the periodontist is my interdisciplinary team member, and he got the gums perfect for me, and then I sequentially then went about changing out all the crowns that had metal in them, which was all in her mouth. And we also placed an implant. The periodontist placed the implant, and then I restored it with a ceramic crown. But she has no metal in her mouth anymore, and you can tell that she looks like a different person, right?
It does change. People say, for the price of your teeth, you could maybe have a facelift. Well,
she wouldn't have felt well.
But I'm saying
she hasn't had a facelift, and it looks like she had one.
But psychologically,
oh yeah, there you go.
It changes you.
Yeah. So there's no question, and you'll see that on some of these other cases as well. It's great we really do get to know the patients very well, and it's a very close collaboration. It's not easy, and we go through it together, and they really become like a part of your family in a way. And to see this kind of an outcome where she's essentially a different person than she was when she first came in. She has energy, she feels better, and she's taking better care of herself, and she's loving it, her husband's loving it, and this is just a great outcome for me.
But I don't think most people think that just by having your teeth changed that it's going to change you, but it does. People don't know that.
Not always,
well,
but sometimes people tolerate things for a long time because they don't understand or appreciate what they're missing, and then when you make a change, then that kind of is like a part of the whole, and then it changes their life overall.
Okay, let's see.
Is another one?
Picture.
Yeah. This is a great case too. So this patient was a wife of a patient that I'd known for a long time, that I'd done work on, so there was a certain confidence level. Most of my patients are direct referrals. I have a website, I have a web presence, but the best patients so far for me have been the ones that have been referred by their friends and family. So she was welcome to our dental family, and as soon as I saw her, I knew that I could do good things for her. She'd already done a lot of the work. She'd had some jaw surgery to improve a malocclusion, but as you see on the left, there's like a gap between her teeth, and it's unsightly, unaesthetic, and she is a beautiful woman. So what we did was the same kind of thing, where we do the wax up and the mock up, and she said, yeah, that looks good. And then I think a year or two after I'd met her, we did these are veneers in this case, which are minimally invasive. It's not like spinning the tooth down, and so she is very, very happy with the outcome, as she should be. But it took a lot of little tweaks in the design to get it just right, and so we can work out a lot of the details before we start drilling on the teeth. So this was another great outcome. So want to do one more?
Yeah, of course.
Yeah, okay, so this is actually my lab technician. This is Judy. I've known her for 37 years, and she had some crowded teeth. It doesn't show super well on this picture on the left, but together we decided that it would be a great idea for her to be a good advertisement for the kind of work that she can do. So to make it work out well, we had to have her see the orthodontist first. So you see a theme here. So I can't just go in there and do the work. I have to have a vision for what it's going to be, and then engage the other professionals, whether it's the periodontist, the oral surgeon, the orthodontist in this case, to get the teeth kind of in the right spot, and then I can take it from there. And so we were using this new material that is unbelievably aesthetic, as you can see, and she got an amazing outcome and is very happy with it.
But it's so interesting that it practically automatically makes the patient feel better about herself or himself. Because it's true. I mean,
well, you know, you just radiate health.
Yeah.
You know, and your smile is your ambassador, right?
It's
like when they do those studies, you look at the eyes, the smile, and you know, it's you know, if you don't have a good smile, people will like hold their hands in front of their mouth, or they'll be self-conscious about it, or they learn to smile in a way that
different way.
Yeah, exactly. Yeah. So you know, there's
I show
not
my
a
teeth a lot
yeah,
too.
well, as you should.
I know. God knows I should. Okay, I'm going to ask you.
Okay, we have one more, I think.
Oh, sorry.
Yeah.
Okay. Oh, let's.
Oh, so this was a great case
look at
too.
that guy.
Yeah. So he'd had some problems, you know, with his teeth, and hadn't been to the dentist in a long time. And so the good thing about this is that not only is a handsome lad, but just turned out great. And I think that you know, shortly thereafter, girlfriend, engaged. So.
Do you promise that?
I just think it gets back to what you were saying. It's just a certain confidence and security.
So psychological, but everything is, right?
Isn't it?
And speaking of psychological, I want to ask you, because I cannot get over some of the pictures that we didn't show, you know, of the accident and the bleeding and stuff. How do you deal with that?
So, excuse my watch. I haven't gotten 10,000 steps yet. But yeah, the psychological part of it is, like, I remember when I was doing my residency at the Veterans Hospital in San Francisco, and I was rounding with some other of my co-residents, and we met a young man who had Lou Gehrig's disease. He must have been like 22 years old. I think I was 28 at the time. And it really upset me. And you know, I think I walked out of the room, and I was actually crying. And one of my co-residents, because I empathized, I felt this could happen to me too. And one of my co-residents came up to me, how much good do you think you can be to this person, you know, with that, you know, state of mind? And so, while I empathize with people, it's my job to be a problem solver, and so I look at it more from like a solutions point of view. But I am not divorced from the fact that it is a psychological burden for patients to come in with, you know, bad teeth, or you know, or perhaps they're just fearful of dentists and things like that. So it's kind of a combination. You have to be a human being and have empathy, but on the other hand, you know, you want to you know, approach things in a very technical, mechanical, you know, thorough way. Oh, here's one more. Almost forgot Kara. Yeah. So.
Oh, look at her.
Yeah. So. I think that she didn't realize, you know, what we could do for her. She's a dental professional as well, and she came in to see me, or she'd been a patient of mine for a long time, and I said, well, you know, I've been doing some of this cool stuff. Let me see if it would work on you. So we did the wax up and the mock up, showed it to her, and she says, I want that. And so that's what we ended up with. And she also changed her life too, in terms of her diet and exercise and things, and I think she's engaged now. So.
Oh, wow.
So I had help choosing the patients from my staff. They'll use her, use him. Yeah. So. Yeah. So back to the, you know, some of the. I think that it's super impressive when you'll have somebody that has had an accident, you know, fall down, you know, lose a tooth or two. But it's just amazing what we can do now with, you know, like I said, an interdisciplinary approach where you involve, you know, the orthodontist, the periodontist, and the restorative dentist to come up with a good solution. And you know, I think I'm blessed to have one of the best teams, you know, specialists to work with, you know, that any restorative dentist could hope for. And you know, I've done so much, you know, work with them, and it's just, you know, we're always in communication, so there's no surprises. And we've helped a lot of people.
How do you keep your passion for all of this going?
I don't know. That's a great question. Like I said, I've been doing it for 37
and you're
years.
not burned out even a little bit.
No, it's like my mentor, Dr. Kroll, said to me, you have to do the ordinary things extraordinarily well, because if you think you can only get up for doing like the big cases or the things that I've shown you here, as I get just as much joy out of doing the most simple, filling on the top of a tooth as I do these other things too, because it's not easy. There's a human being on the other end of it, and I have the opportunity to help them, and so I think I was just born to do this.
I think so too. I think the way people's brains are wired. I
believe
really
it.
do.
I believe it. Yeah.
Totally.
So my wife's a dentist. My daughter's an orthodontist to be. My son's a lawyer. I don't understand what happened. Yeah.
What happened?
But he's doing God's work. He's a prosecutor, so he's a good guy.
Oh, I was going to ask you something else about. Oh, I know. How has dentistry improved in terms of pain?
Oh, great question.
Oh, that's the worst
so
part.
much. Yeah. So I know that some of the surgeons can do IV sedation. Those medicines are so safe now and so effective. I don't do that. I don't have the extra training for that. But so if it gets down to something that's going to take a long time or is really challenging for the patient, the patients can be sedated. In my case, just the simplest things like the local anesthetic, the injection. So what we do is we have really nice topical anesthetics that we put on the gum tissues first. So it's not like getting an injection in your skin, which is painful. I remember that as a kid. I hated that. So, but the topical anesthetic numbs the gum, pre-numbs the gum, and then we buffer the anesthetic now with bicarbonate, so it doesn't burn going in anymore, and it works just almost instantly.
I think that is essential.
Yeah, pain control is super important.
Yeah.
Yeah.
No,
The
really.
injections shouldn't hurt anymore. Yeah.
And as a patient for so many years with you, and I have extra sensitivity, and I always have to have more Novocaine. But what I like about you, Chris, it makes me feel so much more comfortable. You say, is it okay? I mean, you don't just go in there.
Yeah,
You're very...
we try to respond to what's happening to the patient.
Bedside manner, but chairside manner.
Maybe that's genetic too. I don't know.
Probably.
Yeah.
So how long are you going to continue your profession?
As I said, I have no desire to retire. I'll do it. The goal is to stay fit and to do it, for another 11 years, so get me to age 75. But if I get to that point and I still feel good, I'll do a few victory laps. So
tell about your sports, what you do.
Tennis is my game, and but tennis is kind of like a measure of your fitness. So you have to work out in order not to hurt yourself on the tennis court. And I like to ski. I like to walk. My wife and I walk a lot, and we travel a fair amount, and the photography thing. So, and then I love to read. So, those are all the things.
When do you have time?
Well, now I've gotten into this Audible thing, plug for Amazon, but it's a way to listen to books, in the car when you're going from place to place. And Lord knows the traffic's certainly gotten a little bit worse around here.
Sometimes more than you're going, right?
Yeah, but now I like getting in the car because I can enjoy the books.
Yeah.
So, But I try and be fit. Dentistry is very physical, and all of my team, are fit too. Cammie's doing UGEM. She's going to be an instructor. Liz is like a fitness, machine. And everybody, we all have our Fitbits, and we track our steps and things like that, and encourage each other.
And you don't eat cake and candy in the office?
Oh, not, that's the problem, is that all the specialists are always sending us, these goodies, but we try and eat avocados and fresh fruit, oatmeal. No, we indulge every once in a while.
Yeah. But it's so important for people to go to the dentist, to take care of really, because if something is wrong, in your mouth. It can go to your brain. I mean, if you have a
yeah, there's certainly an infection or an abscess, but even more than that, just the simplest things. Any inflammation in your mouth is going to create inflammation in your vascular tree, which can, I think there have been studies that have shown that, you run a higher risk, for, cardiovascular accidents, strokes, that sort of stuff. So, having clean, healthy teeth, I think, really improves, your chances of living a long time.
Well, it's taken me 5 years to get you back.
Let's
and
not have it be so long next time.
I don't want it to be another 5 years, Chris.
I'm sorry about that. You get busy.
But you're so busy, and also your photography is absolutely exquisite. And in each one of your
operatories there, yeah, right.
You could see them. The only thing is that I don't know where all these places are that I want to go to.
That's the most common question, is say, where is that? Where is that?
Yeah.
So the dental assistants all know, but we like to keep you guessing a little bit, too.
Oh, I see. Okay. Well, Chris, thank you so much.
Well, it's been my pleasure.
It really,
I'm so glad
I just think you are superb. I mean, really. Unbelievably, and I've been so hurt so many times, with my teeth, and to experience.
Glad you're in a better place now.
But I mean, I'm just so grateful to you, and you're a great interviewee.
Well, thank you.
Okay.
Really, you're a great interviewer.
And I only wish you the best of health, and continue. Please don't ever retire. And I want to thank our crew. My crew, our crew, we've been together for not as many years as you, but they are so dedicated, and we all do this voluntarily. So,
Well, I thank them too. I'm glad to get an opportunity to get the message out, and maybe we can help some more people that way.
Okay. And of course, I want to thank our viewers for watching. And you know what I always say? I cannot wait to see you next time. Bye-bye.